How is high PVR volume measured for bladder health? How is high post-void residual volume measured for bladder health? Understanding this measurement is crucial for assessing bladder function. Post-void residual volume, or PVR, is the amount of urine left in the bladder right after urination. High PVR can indicate issues like incomplete bladder emptying, which may be linked to various conditions such as bladder outlet obstruction or neurogenic bladder. There are two primary methods to measure PVR volume. The first is an ultrasound bladder scan. This is a non-invasive technique where a transducer is placed on the lower abdomen, just above the pubic bone, while the patient lies down. The ultrasound sends out sound waves that bounce off the bladder and the urine inside it. This allows healthcare providers to calculate the amount of urine left in the bladder. The bladder volume is estimated using a specific formula that considers the bladder's length, width, and height. This method is preferred because it is quick, painless, and reduces the risk of infections that can occur with catheter use. Normal PVR volume is typically less than 50 milliliters in adults under 65 years old and less than 100 milliliters for those older than 65. If the volume is 200 milliliters or more, it is often considered high and may suggest urinary retention. The second method is catheterization. This involves inserting a sterile catheter through the urethra into the bladder right after urination to drain and measure the residual urine. While this method is more invasive, it provides a direct and accurate measurement of PVR. Catheterization is often used when ultrasound results are unclear or when precise measurements are necessary. High PVR volumes, generally defined as greater than 200 to 300 milliliters, can indicate significant bladder dysfunction or obstruction. This can lead to complications such as urinary tract infections or bladder damage. Measuring PVR is essential for guiding diagnosis and treatment in patients experiencing lower urinary tract symptoms or other bladder health concerns. In clinical practice, ultrasound bladder scanning is usually the first test due to its safety and convenience. Catheterization is reserved for cases where further confirmation or detailed assessment is needed. Timing is important. PVR should be measured soon after voiding to ensure accuracy. Overall, measuring PVR is a vital diagnostic tool in evaluating bladder health. It helps detect urinary retention and informs treatment decisions for conditions affecting bladder emptying. Always consult a healthcare professional for personalized advice regarding bladder health.